Okay, on page I6, muscles of the vertebral column. The muscles of the vertebral column, they insert on the vertebral column, and they move our vertebral column, they move our spine. So they permit movement of our spine, our vertebral column. They also fixate or stabilize our spine when we're moving our arms and we're pulling on something. We want to maintain our body sometimes stable and not move, so they help fixate or stabilize. Right now, you're using these vertebral muscles just to stay sitting upright in your chair. You're not moving, but just to sit upright. I'm using these vertebral muscles just to fixate or stabilize my torso or body just as I stand before you, even if I don't move. We divide these vertebral muscles into two groups. Those on the front side of the vertebral column, called prevertebral or hypoaxial muscles, and as we'll see in a moment, muscles on the back side of our vertebral column that are known as, well, if you call the muscles on the front of the vertebral column prevertebral, anybody want to guess what you might call the muscles on the back? Postvertebral. Pre means in front or before, post means after or behind. So we'll see there are prevertebral or hypoaxial, and there are postvertebral or epaxial. The prevertebral muscles are all associated with causing flexion of the spine, bending of the spine. If we use both the right and left muscles, then it pulls our spine downwards, it flexes. If we just use the right ones, it pulls, we have bending to the right. If we just use the left, we have bending towards the left. The first one we're going to talk about is the sternocleidomastoid. It flexes the neck. It causes bending or flexing of the neck. All the other muscles that are listed here, external abdominal oblique, internal abdominal oblique, transversus abdominis, rectus abdominis, quadratus lumborum, and iliopsoas, cause flexion of the waist. So I'm going to start with the sternocleidomastoid. Now I know our first thought is, you mean I got to learn that name? After I explain this muscle, you're going to wish every muscle was named like this one. It is beautifully named. So let's see a picture of this muscle. So on the very top of I7, this muscle, and you have one both on the left side and right side of your neck. It originates on the sternum. Is this fair to say that your sternum or breastbone would be right here along the midline? So it's originating on the sternum, sterno. It's originating also on the clavicle. Doesn't the clavicle? It originates on the sternum. The clavicle are these bones here going laterally, so on the side. And the word for clavicle is cleido. Cleido means clavicle. And it inserts on the mastoid process. Gee, that's why we learned that, the mastoid process of the temporal bone. So this muscle is beautifully named because if you remember the name of the muscle, you already know its points of attachment, its origins and insertions. Sternum, clavicle, and mastoid process of the temporal bone. Originates on the sternum and clavicle, sternocleido, mastoid. Now, what does every muscle do? It pulls the insertion towards the origin. So it originates here, it inserts here on the side of your skull. So what does it do? It pulls your head down. Pulls your head down, causes bending or flexing at the neck. Now, if you use both your right and left sternocleidomastoid at the same time, it pulls your head straight down. But you might choose just to use the right sternocleidomastoid or left, and if you just use one, it pulls it towards the right shoulder or left shoulder, all right, because you're just using one side. So that's a prevertebral muscle, a muscle on the front side of the vertebral column, front side of your neck, that causes bending or flexion. That's the sternocleidomastoid. I summarize it also on I8. Now, in the cat, it's two separate muscles. There's a sternomastoid and a separate cleidomastoid. In us, they've kind of fused together. Now, on a test, on a lab test, since I've got to put the pin in either the sternomastoid or the cleidomastoid on a cat, because there's two separate muscles, if I put the pin in the sternomastoid, tell me it's the sternomastoid. If the pin's in the cleidomastoid, tell me it's the cleidomastoid, because it's either one or the other. What did I write in our simplified handout? So the sternocleidomastoid on our handout here is right here. Notice it's in bold print. 100% probability I'm going to ask that one. It originates on the sternum and clavicle, inserts on the temporal bone, flexes the neck. Now this last column here is what? The antagonist. So what's the name of the antagonist of the sternocleidomastoid? The splenius. So let's talk about the splenius right now. All right, let's look on page I9. So on I9, we said that the muscles on the front side of our vertebral column, such as the sternocleidomastoid, are called prevertebral or hypoaxial muscles that cause flexion. So there are muscles on the back side of our vertebral column called postvertebral or epaxial muscles that cause extension and hyperextension. The muscle that we just mentioned is the splenius. We'll call it splenius. It's also known more properly as splenius capitis. It originates on the thoracic vertebrae and inserts on the occipital bone and extends the neck, acting as the antagonist of the sternocleidomastoid. Now, I didn't really include technically a picture of this in our lecture outline, but let's just say that this muscle right here, that they call semispinalis capitis, is pretty much about where the splenius is. So we're just going to think of that as the splenius. You'll notice that this muscle is originating along the thoracic vertebrae and inserting on the occipital bone. Let's think about what that means. It originates on the thoracic vertebrae. It inserts on the back of your skull, your occipital bone. When a muscle contracts, when it shortens, it pulls the insertion towards the origin. So it's going to pull the back of my head closer to the vertebral column, to my thoracic vertebrae, pulling your head upright and backwards, extending and hyperextending at your neck. In our handout, on side 1, right below the sternocleidomastoid, we wrote splenius. We wrote that it originates on the thoracic vertebrae, it inserts on the occipital bone, and it extends and hyperextends the neck. And notice here where I listed the antagonist of the sternocleidomastoid is the splenius, the antagonist of the splenius is the sternocleidomastoid. So here's the way you study this when you're at home. You don't have your cat at home, but you've got you. So you simply go around, walking around like this. Sternocleidomastoid splenius. Sternocleidomastoid splenius. Flexing my neck is the sternocleidomastoid. Extending and hyperextending my neck is the splenius. Keep doing that until either you remember it or your neck breaks off. All right? So the idea is that's how, by making it physical, by making it real, you actually get this idea. So what is it when you do this? Well, then you're rotating it using, you use your left splenius, and then it switches to the right splenius, and then to the right sternocleidomastoid and the left sternocleidomastoid. Does that make sense? Because by using, literally going around in a circle with those muscles, you can rotate your neck. And it involves other muscles as well. And not only are the muscles on the back side of the neck, which cause extension and hyperextension, there's some very, very important muscles on the back side of our back, the entire back. They are collectively called the ERECTOR SPINAE muscles. There are a whole bunch of them. You can see in this picture, it points to a spinalis, really a spinalis dorsi. Dorsi, dorsal means back. Right lateral to that is a longissimus dorsi. labeled right here, Longissimus dorsi. There's also lateral to that, even more lateral, is an iliocostalis. Now this just shows these three on the right side of the back. They're also on the left. These muscles are very important in causing extension and hyperextension of our spine, of our back. So these are the muscles that allow us to keep our vertebral column, our spine upright. Right now you're using them just to sit upright in your chair, and you would also use them to stand upright. Notice how towards the lower back, the lumbar area, all of these muscles fuse together. And that's why they are collectively called the ERECTOR SPINAE group. And what does ERECTOR SPINAE mean? They cause your spine to be erect, upright. Here's where you're using them. You bend over, and as you straighten up your back, you are using. We summarize them on side 1 of our handout. The spinalis dorsi and longissimus dorsi are both in bold print. They originate on the sacral vertebrae, the lower vertebrae. They insert on the cervical. So what does every muscle do? It pulls the insertion, the cervical vertebrae, closer to the origin, the sacral vertebrae, straightening the back when it's bent. So it extends and hyperextends. Notice the antagonists are the abdominal muscles, which are on the front, which we'll take up right now. Let's go back to I6. We've already spoken of the sternocleidomastoid and its antagonist, the splenius. All the rest of these are largely abdominal muscles on the front side of the body that cause bending or flexing at the waist. Let's speak about the letters B, C, D, and E first. The best picture for this is page I8 again. All right, this is page I8. Here's the belly button. Running right down the midline of the abdomen is a white line. That white line is called the linea alba, which in Latin means white line. An albino, right? Somebody who has no pigmentation, white. What is that linea alba? Do you remember how an embryo forms? When the embryo formed, it started out as a flat sheet, an embryonic disc, and it folded into a tube shape. And we've learned that where did the tube actually fuse together? Right along the ventral midline. That's the white line is literally where the two parts of the tube fused together. Now, running on both sides of the linea alba is a muscle called the rectus abdominis. And again, all muscles are paired, so there's a right and a left. This muscle is mostly well known for creating that six-pack effect, that washboard stomach effect. In order to see that, you have to work out those muscles, and you can't have a lot of belly fat covering up the muscle. But if somebody is relatively lean and they work that muscle, you can see it ripple. What creates that rippling is we had learned that the paraxial mesoderm becomes segmented into somites. And that includes not only the sclerotome, which becomes the individual vertebrae, but the myotome, what becomes the skeletal muscles, becomes segmented. So literally, our skeletal muscles are segmented. So this rectus abdominis shows these segmentations, and that creates this ripple, this washboard effect. What does rectus abdominis mean? Rectus, you should learn this, means straight. So this is a straight muscle along the abdomen. It originates on the pubic symphysis and inserts, oh, that was good, on the sternum. And we've written that. Let's look on our one-page handout. On our one-page handout, you'll see where it says rectus abdominis. It originates on the pubic symphysis. It inserts on the sternum. It flexes the waist. And here's how to visualize that. Imagine this muscle running from your pubic symphysis to your sternum. A muscle contracts. What does contract mean? To shorten. So when it shortens, it pulls what? It pulls the insertion towards the origin. So since it inserts on the sternum, it originates on the pubic symphysis and inserts on the sternum, it's pulling my sternum downwards, so it's closer to the pubic symphysis, causing bending or flexing at the waist. By understanding the attachments, it helps us understand the movement. Now on the sides, to the sides, on both sides of the rectus abdomen, there are 3 layers of muscles on the sides. And here they've been exposed, here they weren't. The outermost muscle is called the external abdominal oblique. Well, it makes sense that it's called external, it's on the outside. And it's called oblique because the word oblique means diagonal. It means at an angle. So the external abdominal oblique is running diagonally downwards. It actually, if we were to look at our chart, in our chart, the external abdominal oblique, we wrote, originates on the ribs, and it inserts on the linea alba. And it also flexes the waist. All right, so it's originating on the ribs. The muscle is running diagonally or obliquely downwards and inserting on the linea alba. Right underneath the external abdominal oblique, number 2, is the internal abdominal oblique. And it's originating on the thoracolumbar vertebrae, and it inserts on the linea alba. Notice how the direction of the muscle fibers is also running it diagonally at an angle, exactly perpendicular to the direction that the external abdominal oblique. So they're actually like crisscrossing. They're crossing or running diagonally exactly the opposite direction. And then the innermost layer, called the transversus abdominis, and the word transverse means horizontal. Is that the first time we've ever heard that word transverse? No. Remember the transverse processes of the vertebrae, we've stuck out horizontally. These words just keep reappearing over and over again throughout the body. So it just means these muscle fibers are running horizontally. Again, they originate on the thoracolumbar vertebrae and insert on the linea alba. The 3 layers of muscles here on the sides are all very thin. But even though they're thin, together, collectively, they're quite strong because the muscle fibers are running in 3 different directions. Diagonally downwards, diagonally upwards, and horizontally. And it's kind of like nylon stockings. You know, they're actually stronger than one would have expected based on their thinness. And what makes them strong is because the nylon fibers of the stockings crisscross. You'll notice that in this picture, right along the bottom, is the end of these muscles. And you'll notice that there's a pair of openings or holes where the spermatic cord comes out. We had mentioned that the testes of a guy actually come out of the pelvic area and descend down into the scrotal sacs during the 9th month of fetal development. In fact, if you look on the previous page, I7, you can see this spermatic cord coming out through openings in the abdominal wall, the lower abdominal wall, and these testes actually migrate during the 9th month into the scrotal sacs hanging below the penis. Because there's a pair of openings or holes in the abdominal musculature of a guy, that's where an intestine can stick out of the abdominal cavity through one of those 2 openings. And when that happens, that's called an inguinal hernia. Now, we'll have more to say about a hernia. But only guys can get an inguinal hernia. Women can't because they don't have those openings in their lower abdominal wall. Looking at our 1-page handout, external abdominal oblique, the internal abdominal oblique, the transversus abdominis, all of these muscles flex at the waist. Back on I6, we've been talking about these abdominal muscles that allow us to bend or flex at the waist. So how do you strengthen those muscles? What would be a good workout for those muscles?
Sit-ups.
Sit-ups, crunches. So when you do a lot of sit-ups, why is that? Because when you do a sit-up, aren't you bending or flexing at the waist? And the muscles that cause you to bend or flex at the waist are these abdominal muscles. So the more flexing you do at the waist, the more you strengthen those muscles. Now, at the bottom of I6, there are two muscles that are also cause flexion at the waist, but they're deep inside of our abdomen. Unlike these muscles, which were superficial under the skin, these muscles, the quadratus lumborum and iliopsoas, are deep inside our abdomen. We can see pictures of them on the next page, I7, on the bottom picture. On the bottom of I7, this shows these deep flexor muscles of the abdomen. Now, the quadratus lumborum is shown right here. It's labeled. And now that I've shown it to you, I'm not going to test you on it. Not going to test you on it. So why did I show it to you or say anything? Because some of you want to go into fields like physical therapy, occupational therapy, and so on, kinesiology, and you're going to have to know all these muscles. But for the rest of us, right, this is more muscles than we ever wanted to know. So again, different fields need to know different amounts of stuff. The muscle, though, that I do want you to know is also shown in this picture is a muscle called the iliacus and the psoas major. Now, the iliacus is going from the femur to the ilium. This is on the anterior front side. And the psoas major is going from the femur to the lumbar vertebrae, to the vertebral column. That's called the psoas major. Now, you'll notice that both the iliacus and the psoas major both originate really at the same place on the femur. Because they do, they are commonly referred to collectively as the iliopsoas muscle. And that's how we're going to refer to it as, the iliopsoas. That's a contraction of iliacus and psoas major. So this is a deep flexor muscle. Let's try to visualize this. What does, we know muscles contract. What does contract mean? They get shorter. When they shorten, they pull the insertion towards the origin. The origin is the femur. It inserts on the pelvis, the ilium of the pelvis, and the lumbar vertebrae, the vertebral column. Let's imagine these muscles shortening, pulling on the vertebral column and pelvis, and pulling them towards the femur. Well, as they're pulling them, the pelvis and the vertebral column towards the femur, isn't it causing bending or flexing at the waist? Can you visualize that? So this is a deep flexor muscle. Now, I'm going to mention something else about this muscle. This muscle, and there are many muscles that do what this muscle does. I call this muscle a switch hitter. Now, that's not a technical term. That's not a term that you'll see in an anatomy book. But what I mean by a switch hitter is that this muscle can switch as to which end of it is stationary and which end moves. And I just borrowed from this baseball term. In the world of baseball, a switch hitter is somebody who can either bat right-handed or left-handed. Anybody ever hear that term, a switch hitter? All right, so this muscle can switch as to which end is the origin and which end is the insertion. Now you might say, what does it mean? What is that, it reconnects? No, it doesn't reconnect. It means that when I explain the femur as the origin and the vertebral column as the insertion, it was pulling the vertebral column closer towards the femur. But this muscle can also act where the vertebral column is the origin and the femur is the insertion. You'd say, what would that look like? Then it pulls the femur, the thigh, closer to your pelvis and vertebral column, causing what's called flexion of the hip. So this muscle either pulls your vertebral column down towards your thigh or brings your thigh up closer towards your vertebral column. So it actually does both actions. And in fact, many muscles can do exactly that. They can switch as far as which end is stationary and which end moves. Let's look at the Iliopsoas, I actually wrote it down on side 2. So you'll notice the Iliopsoas on side 2 of the handout, it originates on the ilium and lumbar vertebrae, and it inserts on the femur, and we wrote that it either flexes the thigh or flexes the waist. Now again, technically which part is the origin and which part's the insertion switches. So we have now completed the muscles on I6, the so-called prevertebral muscles or hypoaxial muscles.